after the scientific award, we enjoy, we celebrate all together our award recognition. This is unique event, specialized for all the health, wellness, and aesthetics professional. And also 2024 science, and we did the research, global interview scientific research. And here is the best way. Today we have more than 35 countries participating in this community in global interview with more than 20K professional as attendings. So that's the miracle work. But I want to tell you something very important. Without your support, this community cannot grow. So this growing, this movement is just thank God for each one of you and everyone who are supporting global interviewing. This is the best example that I can show you. When we started on 2020, the first VIP speaker, just only on 2020. And this is 2026. So all the speaker from today is going to be here. So the speech, the space, the square, little square space is going to be little than this, or probably we had to have two, because at this point is we don't have more space. But thank you for your time, everyone here, and all the professional is all over. That's amazing opportunity to show you. That's why we create the methodology of global interior beauty for branding
Sorry,
position.
Idalis, I'm so sorry to interrupt you, but we don't see the PowerPoint.
No?
No.
Oh, wow. 1 second. No? But they could, or they stop and or never was a PowerPoint. How about now? No? 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 I don't know what happened. Let me see. I don't know why it's not. Okay. How about now? No?
Yes, Idalis is on.
Okay, perfect. Okay, this is just to show you the best image to show you how we grow from 2020 to 2026. We started only with the Global Interview Seminar, the networking, and then the hashtag. From 2020 to 2026, we have ready just 4 annual Integral Beauty Conference, annual here in Mario Marquez in New York. That's amazing event. At the end of the year, where everyone is celebrate all the our passion and our love for from 4 year consecutive. And this year is going to be on October 17th in the Mario Marquez. Everyone is welcome to be part of this amazing event. And as you see, we have more than 35 countries participating in this global interior beauty community, and more than 20,000 K data professional. So congratulations again, because of you, everyone just give a beautiful time. And for us, we appreciate that. This is the professional that we inviting for 2020, how we starting. And this is now 2026. I told you before, we don't have more space, because it's so many professional. And thank you again, all the professionals who are connecting today. We are from that world, we create the methodology, the global interior beauty for branding position. We are working with each individual professional who are part of our legacy pro membership, and we are working all together in the professional image. We are working in the investment in branding and connection strategy, and also in the high level education. At the end, of this seminar, we're going to do the raffle for 1 ticket for the conference. So you have to pay attention about this, and we're going to continue later. Okay, so now we're going to continue with our first panel, and we like to invite the 3 VIP guests for this special panel. We have Amy Peña, medical esthetician. She is a master and also instructor in aesthetics, very famous. We have to talk with her later. And also we have Irene, specialized in holistic facial. Thank you to be here. And Emilia, you are here. I would like to see your face. Okay.
Can you see me okay?
Yes.
Okay.
Just 1 second. Give me 1 second. So the panel that we're going to discuss now is the impact of social media on beauty standard. So we have 3 VIP guests today where we work with them. I would like that very short, have a little bit time to introduce each one, just a couple minutes, 1 minute each one, just to introduce yourself. It's Emilia Brasher, Irene Sedali, and Amy Peña. Could you introduce in 1 minute yourself, where you are located? I would love to hear from yourself, because it's the best way how we can share your information. We can start with Irene, please.
Thank you, Idalis, and forgive me if I'm not looking in the right direction. I can't see anyone on my end. I can only see my image. I have a technical issue with Zoom. I have been doing aesthetics from a very young age, and I have been licensed in the state of New York since 2005. And my career took me internationally and even on cruise ships. I specialize in doing a more of a holistic practice, but my background started in medical, in luxury retail, in training, and so forth.
Thank you very much, Irene. Thank you for your time.
Thank you for inviting me. I'm sorry I can't see anyone.
No worry, don't worry. That's the idea. We are working with you. It's an amazing experience for you too. Emilia, we are inviting you, Emilia, to introduce yourself, please.
Hey, my name is Amelia. I am located in Missouri. I've been a licensed esthetician for about 5 years now, so I feel like I'm a little bit of a baby compared to some of the people that are here today. But I really fell in love with aesthetics in 2020 when I was locked up and didn't have anything to do except sit on YouTube and look at skincare videos and makeup videos and all that. So I really fell in love with making people feel good about themselves. And I know, especially in our panel, that's very important when it comes to social media. But yeah, I've been doing this for just a little bit, but I'm absolutely in love with our industry. I love that we're doing this and getting to spread information and learn more because we're always growing. This industry is always changing. So
Thank you, Emilia. I appreciate your time. And also we have Amy Peña, medical esthetician specialist too. Welcome, Amy.
Good morning, everyone. I'm super excited to be here with all of your professionals. Thank you for giving me the time to share with you my 10 years of experience in the industry. I'm a medical esthetician. I'm in Philadelphia, and I'm super eager to hear your experience also in the industry, because I know this is an industry that evolves year after year. And I can't wait to give you my input and everything that is happening right now. And thank you for having me again.
Thank you, everyone. Just from the beginning, enjoy this time, everyone. Irene, don't feel bad because everyone is the same. Is in the same position. You
The
cannot
end one, I feel so
know
sad.
everyone, but we see you perfect, like everyone here. I really appreciate your time, and also remember that we have a timer because we love to continue with the schedule. So we have a question, and everyone have limited time, but again, enjoy quality but no quantity. So be very specific with your question. We're going to start with Emilia. Emilia, how have social media changing clients' expectation? And how do you keep them realistic?
So with social media evolving, I feel like just as fast as our industry does, so are things like filters. They're not the same filters they were when social media started. Editing is getting so much better. And now, especially introducing AI, a lot of people can't look at images online and tell the difference between if that's real or if it's not. And most of the time, I think it's not. But that sets really high expectations that people see influencers and celebrities online talking about miracle products that save their skin that don't work for their skin type or are too expensive for them to afford. So they start to fall into this habit of thinking that they can't achieve things that are very achievable. They just don't have miracle fixes for them. And I think it's our job as estheticians to really communicate with clients and put out our own information, our own Facebook posts, Instagram posts, TikToks, explaining how things work and how you can use them to better your skin and not hurt it by trying all of these crazy products that people are putting out saying they work and they don't, or you don't know what's in them. So it's really, I like to be really thorough with consultations and really get to the root of their problems and give them as much information as I can to help them on their journey.
Thank you, Emilia. I agree with you. Definitely, that's the major part of our work. Just give them the real expectation during the consultation. That's why we cannot do, usually, we are working more like boutique. We don't do walking, it's more by appointment, and just give them the real time to offer the professional consultation and real expectation. Thank you very much. Irene, how do social media beauty standard affect the self-image and how do you address it?
When you sent me the question, thank you for the question, and I agree with Amelia for what she said. This may sound very cliche. This is one of the things I've always said is a woman must really feel comfortable in her own skin. When her inner comfort is aligned, even if she sees something on social media, her brain can separate reality from fiction. It's too it's very competitive out there with the filters, but what is online, it's not real. The pictures aren't real. The filters. Now you have AI models in a more of a holistic approach. And I've worked in luxury settings, medical settings, corporate settings in skincare. I chose what is aligned with me, what I've always done before it became a trend, before it became the next click and bait on social media. And for what I say to estheticians, regardless of what path you follow, is authenticity. Your clients will find you, but what is important in more of a holistic approach is the esthetician is she's integrated with her client. She's not separate from that. When you are separate, it's like a protocol. It's like 85% follow a protocol and 15% are creative. And they'll take aesthetics into a different path. So to be kind, I know it sounds cliche, but it's more of to help them relax. And yes, setting the expectation. And there's something that I don't like to do. I don't like to feed what I call the insecurity, the Achilles heel. I always say that. I will not feed into that. And it's very hard for me because I see women of all ages, and it's affecting now a particular age group that did not affect it a decade ago. And they look in the mirror, Edales, and they don't think they're beautiful. They think wrinkles are ugly. Wrinkles are not ugly. So the social media has definitely, respectfully, has messed with people's perception of what is beautiful. It's not just the external. You want to look good, you want to feel good. When you look good and you feel good, your energy vibrates. Yes, but then it crosses a line where it can be very dangerous, if you understand what I'm trying to say, mentally, to their mental health.
Thank you very much, Irene. I definitely agree with you. It is very important from our side, educate them. Educate them, make them feel like safe, secure, because usually they come into us usually when they feel very down. But also we have to be very honest with them that we are not psychology. But we can guide them, we can advise them without lose our line that we are until what part we can just working with them. But I agree.
Exactly.
Amy. Amy, the question for you is, are more patients influenced by social media and trend? And how do you manage that expectation? Because today they come in with the phone, with the picture, like they want the face like this. What do you do that with them?
Well, absolutely. I mean, social media has completely transformed the way patients approach skincare, aesthetics, right? Today, almost every client walks in with some level of influence from platforms like Instagram, TikTok, or even conversational tools, right? Like ChatGPT. I just had customers a couple of weeks ago that told me they found me on ChatGPT. So we can't ignore that this is happening. It's something that we have to acknowledge and learn to work with it. The reality is the social media is now the first point of reference for any of our patients, for many of our patients, no matter if they are educated or they are not educated, they are young or they are older. Everybody is their first source of information, right? And some of them have convinced about certain trends or outcomes, right? Some are very informed, but some others, unfortunately, are very misinformed and have these unrealistic expectations shaped by filters, right? Editing pictures or viral content. As a professional, our role, I feel like is not to dismiss what is happening. I think coming from the point of kindness, because Idali said something that is true. A customer comes to us normally when they are down, right? And I have been in positions where what I heard is so impactful that I think, wow, you're wrong, right? And my mind goes to the judgment. The professional mind comes to, wait, why will you even read that? Why will you even think that, right? But I feel like we have to understand that that's the world that we live in now, and this is the responsibility that we have now. Very different than back in the times when we had an authority and people would come to us expecting us to inform them. So by the growing of this group of people that are deeply influenced, sometimes they are even conditioned to condition us to the outcome, right? So what I do, I try to meet them exactly where they are. I listen first. I let them express what they believe or what they have tried or what they are expecting from this specific treatment, right? And then I say, normally, like, I feel like you've been dealing with this for a long time. You've been doing this for a while, and seems that things are not working out for you. Otherwise, you wouldn't be here. You wouldn't have looked for me, right? And I feel like that is a kind of powerful and shifts things a little bit. And some of them are going to be extremely welcoming to us, explaining and maybe setting the expectations right. Some others won't. Some others will feel extremely offended, and if we don't know what they are talking about or agree with what they are saying, they are going to feel that we don't know anything, right? And I think as a professional that has gone through all the education and all the trainings that we try to go through to bring the best to our customers, sometimes it's very hurtful to hear that, and it goes against our egos, right, as humans. So I will say, always approach everything with kindness. Remember, we also are learning this new world, this new reality. There is going to be things that we are going to learn from those patients. And there is things where we have to have the authority to say no. We have to have the authority to say, your expectations are not real. And also we have to have the integrity to say, maybe you are not the right customer for me, and let them go. I feel like if we practice those things, we will grow as professionals, and also we will gain the trust of the right clientele. At the end of the day, the right clientele, the ones that are going to trust you, the ones that are going to listen to you, because our job bases on results. If the customer doesn't trust you, doesn't follow what you say to do at home, they won't do it. Therefore, it doesn't matter that you did the best treatment ever. If the results don't last, if they don't see the results at home for a while, you lost the customer. They lost the trust on you. So I feel like, let's start, instead of fighting this reality, let's face it, is a reality. Try to listen to the customer again, always, and try to understand where they're coming from. Set the expectations right, be honest with them, but also be honest with yourself as a professional. That balance will create a long-term results and loyal customers.
Thank you, Amy. 100%. 100% agree. The best way to emphasize the really big difference is education. 100% education. Second question, Emilia. How can esthetician help counter unrealistic beauty standard online?
I know we talked a lot about education. That's been a theme throughout this panel. Education is the best way to get straight into their minds and let them know, what am I trying to say? Basically hit their false expectations right on the nose. But besides that, I do little things here and there. Obviously, I'm not a mental health professional, but sometimes as estheticians, we act as therapists during treatments, and we get to listen to them talk about their problems and complain about whatever is happening. So I like to take those moments when I really feel like they're struggling to say, hey, do you think it would be beneficial to talk to, I don't want to say talk to someone that knows what they're talking about, but I don't know what I'm talking about when I help you, when I'm talking with you through these things. Maybe it would be beneficial to see a therapist and talk through your self-image issues, because social media is really impacting those right now. I do little things like I don't wear makeup to work. So when people come in and they see me, then they see my texture, they see my breakouts, and they kind of subtly gives people the impression that even my esthetician who does skin for a living doesn't have perfect skin. And sometimes we use that as a talking point when they say something about it. They're like, no one has perfect skin. And even if you see people on social media with perfect skin, it's not real. So that's one of the little ways that I feel is really impactful when I start talking to my clients about their skin and their skin imperfections, and having real expectations is showing them something real.
Thank you, Emilia. Continue the same. I think that that's the most important part, that we have to work together also. no individual, together, because every single day we have this kind of patient in our spa or medical spa. So we can share our experience too. So it can help each other to support. All right. So let's do it. Let's go with the second question for Irene. Irene, the second question is, how can holistic beauty shift focus from social media to self-confidence?
Again, it really comes down to the inner alignment of the individual. If someone is extremely insecure and they don't feel beautiful, Idalis, no matter what the therapist is going to do, unfortunately, in many cases, she's not going to be able to succeed. And in many cases, she's going to be able to give them the confidence. As if when I hear with my clients, thank you for giving me the confidence. It's about being real and authentic. And usually, real and authentic, if we take with the social media, it may not have the millions of views or the hundreds and thousands of likes. It is to always remind our clients they're human just like we are. They question things just the same way we may question something about whatever topic it may be. It's really important to feel good on the inside. When you feel good on the inside, even if you go and you get the worst facial or the best facial, you're still going to glow. When you're not feeling well and you go and you get a facial, your energy, the holistic aspect of it, it's really trying to cut out the noise, and it's very difficult in the world where we're in. And I'm not saying avoid it. I'm just saying don't be consumed by it, if that makes sense.
Thank you, Irene. Yes, definitely the emotional part is a special role for this topic. I think we always think that the social media is negative, but it's not negative. It's the way how
No.
it's the way how we can manage and educate all the community. But I agree with you. And let's continue with Amy. The second question, Amy, is what responsibility do you have when patients are influenced by beauty trending?
After everything that I heard from the two other participants, I feel like we understand that the ethical responsibility is now stronger than ever, right? It's not just to perform treatments anymore, but it's to protect, educate, and guide. Ethically, we have to have the filter between what is trending and what is truly right for the patient, right? Not every trend is safe, not every trend is necessary, and most importantly, not every trend is individualized. And one of the biggest responsibilities we carry is to protect the patients from harm, right? Including overtreat them, chasing unrealistic filters, results, right? Following protocols that are not designed for their skin types of conditions. And here is where integrity comes in. We demand, because we do, the ideal customer is the customer that is gonna let us guide them, right? We demand the ideal customer. But we can also, we have to provide integrity in what we do, because that's what the ideal customer deserves, right? Like Emilia was saying, we have to be able to present ourselves as the professional, as the person, as the human. Also, the other panelist says we have to be a whole. We have to be a whole. I totally agree with Emilia. We have to perform our services. I personally don't like to judge women, because we all are women and we are being judged. But it's a little bit unprofessional to be an esthetician and not to be able to show perfect skin, or at least clear skin, or at least a skin that shows that you work on your skin as well. Then is when you gain that trust from your customers. Your customers are looking at you. You want to be the authority, so then present yourself as one. That's where integrity completely comes into place, right? Remember, just because the patient is asking for something or saw it online, or that doesn't mean we have to do it. In fact, sometimes the most ethical thing to say is not, right? But how we say no matters. Because remember, people that comes to look for beauty already has certain things going on in their mind, right? And we have to be kind and we have to be understanding with this. And again, how we say no. It's not about rejecting the patient, it's about redirecting them, right? With care and authority. I understand you want to do this. I've seen it too, but let me explain. Your skin actually doesn't need it. And why this approach will give you a better, safer, long time result, right? Because at the end of the day, guys, patients trust us with their face, with their skin, with their confidence, and that's something that we can't take lightly. We also have the responsibility for realistic expectations. Social media is against us. Doesn't mean we cannot work with it, but what people, our customers are seeing there, and normally will create a problem for us. We have to kind of confront the customer, confront the patient, right? And those transformations without a context. But with time, consistency, and the right strategy, we can shift what our customers are seeing. And always, 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 we must set the right expectations. Be honest about timelines, be clear about outcomes, and never overpromise something that we can achieve. Okay? For me, always comes back to the question, are we serving a trend or are we serving a patient? And if we stay with this question in our mind, we will always make the right decision, because a true professional is not, we don't do what is popular. We do what is right for our customers, and we do what is right for us as providers. As long as we continue guiding ourselves with those guidelines, I think we're going to create long lasting relationships, and we're going to create long lasting businesses. One of the things that I feel like my customers come back to me for is that honesty. No, I won't do that. No, you shouldn't do that. Let me tell you this experience. Let me tell you what I heard after 10 years in the industry, listening to story by story of different women that have done so many things to themselves. And at the end of the day, some of them, no matter what they do, they are still being extremely unhappy with themselves. So sometimes trying to share those stories, remember, back in the times, women couldn't talk to each other. Now we can, and that's our magic power. And we should use it, and we should try to make that what makes our business unique.
Thank you very much, Amy. I agree with all, Irene, and also Emilia. As a skincare expert, let's remember the truth of the beauty. It's not coming from filter. It's coming from healthy, knowledge, and authenticity. That's the idea from our major word in global interior beauty. In and out. That's why the global interior beauty is focused with all the community, health, wellness, and aesthetics. Our role is to educate, guide them, and protect each patient. May feel them confidence. We treat skin, but we building self-esteem too. Thank you for your participation. It was amazing. I really appreciate for your time. And remember, everything is record and you can share all over all the social media. When we finish our seminar today, we also going to just share all everyone and enjoy an amazing day. Thank you very much. Thank you. Continue with our program today. We are inviting and our next panelist, because now is coming the video, but our next panelist is going to be Jason Estela. Just preparing yourself, Jason, and we have a few minutes from one video.
What if the next level of your career wasn't found in another course, but in the room where global leaders gather? For years, I've built an international platform dedicated to elevating professionals in health, wellness, and aesthetics, not just through education, but through visibility, collaboration, and global positioning. Many talented professionals remain unseen. They invest in their craft, refine their skills, yet struggle to access the level of exposure, connections, and recognition required to truly expand. Because success today is not only about what you know, it's about where you are positioned and who you are connected to. The annual Global Integral Beauty Conference is not just an event, it is a global ecosystem designed to accelerate your growth, your brand, and your influence. A curated high-level experience where education, networking, recognition, and visibility converge in one place. Here, you gain direct access to international speakers, industry leaders, and innovators shaping the future of aesthetics and wellness. You step into powerful networking environments designed to foster real collaborations and business opportunities. You position your brand in front of a global audience, opening doors to expansion beyond borders. And for those ready to elevate even further, this is where recognition happens, where your work, your story, and your impact can be acknowledged on an international stage. This is not attendance. This is alignment with a global standard of excellence. If you are ready to elevate your brand, expand your network, and position yourself on a global stage, join us at the annual Global Integral Beauty Conference. Sign up now and step into the room where your next level is waiting.
Thank you. Today, I want to invite Johnson Estela. She's CEO and also she is a nurse practitioner. She is an expert in functional medicine and expert also in injectable. Estela, welcome, and her presentation is going to be Bring K-Beauty to Life as a skin-first layer approach to aesthetic medicine. I have the opportunity to have a special treatment by her hands, and I invite you can go to Idali Pirisavi to enjoy the experience that I have with her. Thank you, Stella. Welcome to Global Integral Beauty. She is one of our leaders of the Global Integral Beauty. Welcome, Stella.
Thank you so much. Good morning, everyone. Should I share with my presentation if you want?
Yes.
Okay.
I think that you can share now.
Okay. Okay, will you able to from the beginning, will you able to see my presentation?
Yes.
Okay, cool. Okay, good morning, everyone. I want to start with a simple question for you guys. Why do some treatment look like sometimes it's don't last, and then in the beginning it looks good, but it's don't last? And why do some patients keep coming back but never feel fully satisfied? It's not because we are not doing enough. It is because I believe we are not always treating the right layer. Today, I'm not here to talk about one device or one technique. I'm here to share a different way of thinking, how to treat the different layer with the different devices, different techniques. A way that focus on skin first, treat layers by layer, and creates a result that are not just visible, but sustainable. So K-beauty is most seen as a trend right now, but something about glow, glass skin, and skincare routines. So we have several skincare products to routine, and you have to put the layer by layer. And it's a lot of skin products out there. But in Korea, it's not a trend now. It's about the system, how to build up the strong and healthy skin. A philosophy built on one idea, healthy skin creates beautiful results. Instead of asking, how do we fix this? We ask, how do we prevent this? Instead of chasing correction, we focus on maintenance and regeneration. This is what we call a slowing aging, and then we can even delay the aging process. Supporting collagen early, protecting the skin barrier, improving skin quality consistently. And here's the shift. We start focusing on the volume first, and we don't want the surgery, or we don't want the downtime, and we want the minimal invasive result with the optimal result. And we start focusing on the skin quality first. Because when the skin improves, everything else, lift contour, brightness, minimize pores, everything is improved. So the problem with a single modality treatment is, but in reality, what do we see often? We rely on one treatment, more filler, more energy, more sessions, and still the result is we don't see the big improvement. Patient look treated but not refreshed. Why? Because we are treating what we see. We have to see the whole picture, how they will improve in as they get better. Because we are treating what we see and not what happening the underneath of the skin. And then we have to respect how the skin layers, how the aging process, and then we treat the layer by layer. And that's where things start with the from connection, how to treat the skin. So in my practice, I don't really over rely on fillers on or one device, and then I'm not looking for the short-term result. I'm looking for the long-term goal. Always when I consult with my patient, I sit down and I made a plan, like a 3-month plan, 6-month plan. So it really gives me allow to retention client more than like a one-time client, and then we build up the more trust each other. And I also see that everybody is asymmetry, but as I treat the multiple session, I look at their balance in harmony, facial harmony. Also, we cannot never ignore the skin quality. So this is very important how we treat the skin layers. We need the layers anatomy-based approach. We have to respect when you treat the patient. Okay, so I just want to briefly talk about the facial anatomy. And we have a bone structure, and then above that fat compartment, and there's above the muscle, and then ligaments and skin. So every face has a structure, and bone supports it, and fat shape the face, and ligaments hold the muscle and all the fats and skins, and skin defines what it is. If we don't understand these skin layers, we are not treating. We are just guessing. So the question becomes: are we treating the patient's anatomy? We are respecting patient's anatomy, or are we treating the trend? So the previous speaker was talking about the trend. We are not following the trend. We are always respecting the individual skin quality and then respect unique skin foundation. Okay, so for keep going, aging doesn't happen in one place. So we have to understand that each skin layers also have the subcutaneous, dermis, epidermis. So each layers we also treat it differently with the devices and collagen fillers, microneedling, pills. So for subcutaneous, usually I treat for the muscle mass. Usually treat with the start with the wood therapy prime to lift it, and subcutaneous with the RF microneedling and dermis as well. Epidermis I use the microneedling, skin booster, pills, and facials. So each layer requires a different modality and strategy. Every treatment decision starts with the anatomy. And aging doesn't happen in one place. It happens by layers. At the surface, tone changes in the dermis, collagen declines in deeper layers, support weakness and tissue descent. That's why each layer we have to respect because it's aged differently. But many treatments treating everything the same. That's why results are temporary. It's not for a long-term goal. So because aging is layers, treatment must be treated by the layers. And for the skin quality treatment, patients often say, I want to look better, but I don't want to change it by myself. I just want to be a better version of myself. They're not asking for the volume. They're not asking for the dramatically big change of the result. They're asking for the better quality skin and then looks more rejuvenation. So they want a smoother texture and even tone and more skin laxity and natural glow. This is a skin quality that I believe I always make a standard. And this is where real transformation begins. So I always treat starting from deeper layer, which is a structure. So like I say, I have a three main lifting and tightening procedure in my practice, which is ODP, jerv, and density. Each device is treat differently, targeting the different layers. So for example, deeper layer, I use therapy for lifting and ultrasound delivered in the smart layer where the surgeon usually lifting for the facelift. And also JERF also works well for the lifting procedure because it dual frequency, known as a dual frequency. So it combine with the lifting and tightening procedure. And for the step two is we are targeting also mid layer, dermis quality wise. So I treat with density and jerf at the same time and to stimulate collagen and elasticity and then more it's very while the jerf is very powerful for the lifting and it's also good for the tightening as well. And after that, I treat the more in the between. If the patient has a severe sagging jaw, in between the deep mid, this is really highlight in my practice. I developed that it is good to have a biostimulation in between the skin layer, a deeper layer, and mid layer. So biostimulation with hyperdilated with the radius I use and it stimulates the collagen 1 to 3, elastin stimulation, and it develops more healthy skin and structure. It's more balanced. So if those people who are not qualified this biostimulation after they could be enough with the nerve and density, but I do see some people really I do see like 70 over 70, 80s, depends on the skin quality. I also provide this biostimulation between that. And also the step three is a surface. So I do treat with the laser microneedling and I focus on the skin texture, tone, and then step four is regeneration. So always go with the skin booster, such as I use Elastilabs, Regeneron, PM, PDRM, PRP. So all these kind of things and stimulate the hydration, repair the skin, and collagen booster. And okay, so why we treat the layering works? Because address not root cause, and it's not a symptom. We have to address the what's the cause, and enhance synergy between the treatments. Because after the treatment with the wood therapy prime and for the lifting, we also treat the mid dermis layers to stimulate together for lifting and tightening. Produce natural result, and then I don't need to put much more syringes in their face, and then improve the longevity of outcomes. We are not adding treatments, more volume with the syringes. We are building a system for the healthy skin. it's very important to address the patient assessment. I always see, once I consult with my patient, I always see their facial analysis, structure, skin, quality, thickness, sensitivity, and degree of laxity. And I always looking forward to patient goal, even if I have thinking, oh, this is my priority, but it's not. For patient priority, maybe this is the marionette line is first their priority more than the wrinkle. So I always respect their concern and their perspective value. And then I also it is very important to treat the culture respect the culture, because as I'm Asian, I respect the Asian volume. They don't want to be look like more sunken here, and they don't want to projection the zygomatic area. But most white people, they really want to be volumized. So you have to respect the culture competency, and culture clinical tip is customized energy levels and modality per treatment. So everybody is different. Everybody think that even like lips, I fix the lips and then they want more volume, but at the same time I have to respect the patient's perspective. And for my case study, I want to share with my case study based on what I did, respecting skin layers towards the K-beauty to the how it transformed my patient. So this patient is a really recent patient. She has been with me for 1 year only for the Botox, and then she wants to be more confidence about herself. So recently she wants to asking about how Stella, how to I fix this Mariana line and lower face. I wanted to be more skin tighten. And then I told her, oh, it's not always, we cannot say that because we are not the surgeon. We are always assume that it could be really helpful, but with the skin quality wise, it can be more rejuvenation. So I start with the treat by the layer. So it happens. It was really miracle, and she was so happy about it. So layer skin first protocol. I always go with the devices. Energy-based lifting tightening is always number one. So I use for her, I cannot use a therapy prime because it can also melt her fat, even though it's lifting effective. But then I use a Zerf treatment because it doesn't melt the fat. Deep layer, I structure lift, and then mid layer, I use also different function of the Zerf for the tissue tightening. She did the 2 treatment of Zerf, and then structure support, I did the hyaluronic acid or CAHA to stimulate her collagen remodeling and restore her cheekbone support and vector lift. And I also use a biostimulator for her skin quality as well. I use the hyperderm radius for dermis and subdermal area to stimulate collagen and improve creepy skin. And refine the layer, I go by skin booster with the micro needling for fine lines, hydration, that texture enhancements. So overall skin quality is an improvement, and then while she's lifting more firm, and it becomes more natural looking lift, improve skin quality, as I address all the layers, and then it becomes a longer lasting, structurally supported result. So K-beauty signature approach is in my practice, this is how we approach every patient, and every client is becoming I participate in their beauty journey. It's not a one-time fix. And skin, I always targeting skin first, protocol base, layer, intentional. Always skin quality is our first philosophy as a K beauty is in hand. They think the skin first is their first philosophy. And layer anatomical planning is very important, and natural refined result, we are always focused on it. And the one key element is combine energy with the biostimulation. And tree anatomy is not just appearance, and then you have to expect the what will be look different after these devices, and then you have to visualize ahead of it so that you can, even if you can put the filler, it can be minimized. And then you have to always check the patient as a follow-up care after 2 months. I mean, after 2 weeks of the treatment, and then after 1 month. So you have to keep monitor how they enhance their beauty. Address each skin layer with very carefully with a different device, not too much energy. So less is more. Always think about it, and then it's better to targeting different layers. Prioritize regeneration over correction. Focus on long-term skin quality. So energy prepares the skin and it activates collagen and creates the environment. Then we introduce the radius for the regeneration skin care, and that's not the volume and for the skin quality. It stimulates fibroblast and build collagen and elastin improves skin texture. Together, they don't just treat and they rebuild healthy skin together. And this is a collagen first aesthetic. So I want to emphasize that treat the layer, build the skin, elevate the results. Okay, so the future of aesthetic is not about aging more. It's about understanding more about anatomy and trust how to hold on. So I'm sorry, we understanding anatomy, and because when you treat the right layer, you don't chase the result, you create them. Thank you so much.
Thank you, Estela. I really appreciate this information, and I love your presentation. It is very important for everyone to know the aesthetic regenerative. So that's the combination with the new trending. It's not trending really because it's more like medical approach, but it's good to know in professional hand where we can go, where we can choose to do the treatment. That's why we are doing this seminar every twice a year, just to invite all the best professional in the industry to continue with our high level education. I appreciate that. If we have any question before continue with the video, I have one question for you, and it is the question is about only it is working with the technology doesn't damage the skin if the patient decided to do a plastic surgery later. There is any inconvenience for that, or is the opposite? Prevention is better, and then later if they need the plastic surgery, they are allowed to do it.
Yes, basically, for the energy devices, it's better to have a prior to surgery and then after the surgery. Because, for example, for surgeon, when you are looking for the surgeon, you really want the lifting procedure. Most of Korean, they want the minimal facelift. But, it is very important to address skin quality, because facelifting doesn't mean that they are addressing skin quality. They are tagging the smooth layer, which is above the muscle, where the lifting happens. So Ultra Prime is non-surgical facelifting, where targeting smooth layer. At the same time, it stimulates the collagen. So they emphasize that after the surgery, you have to maintain skin quality, and even before the surgery, it's very important address skin quality. However, some people do the like a thread and the fillers. It is kind of risky to when you go to the surgery, but that's why I always emphasize the less is more, so you can become a natural looking result.
Thank you, Estela. I really appreciate that again, and thank you for your time too. So we're going to continue now with a video. I'm waiting for the next presentation, Dr. Stewart, that I think that he have an emergency now, but we're waiting for him. Thank you, Estela. The video, please.
Attention global integral beauty community. Nominations for the 2026 Awards Gala are now open. And this is not just another gala, it's your night of recognition, your moment to shine, your legacy on stage. A night to celebrate the hard work, passion, ethics, and professionalism that have brought you here. Are you a legend who has left a lasting mark, an epic leader creating global impact, or a revelation breaking boundaries with innovation and power? This is your opportunity to be nominated. Don't wait any longer. Visit the site, nominate yourself, and become part of an evening that will transform your profession forever. Because we all deserve to be recognized for what we love to do, right? Your story deserves to be celebrated. Comment award and we will send you the 2026 nomination link.
Okay, thank you very much. We're waiting for the doctor, just a few minutes. The following panel before Dr. After Dr. Store presentation is going to be longevity and preventive aesthetics. So if Dr. Olga is here, Lisa Esquivel Clark, and also Noel Brown, let me know so we can switch until Dr. Stuart finish his emergency. Remember, at the end of the presentation, we're going to do the raffle for the standard ticker for all who are connecting today. So please don't wait until the end, and you will have the opportunity to have the standard ticket for our conference that is going to be on October 17th. So I appreciate that your time, but also you have the benefits for your time too to have the ticket. Dr. Stuart is here or not yet? So until Dr. Stuart is coming, so just remember for this is the raffle that we're going to do for the tickets at the end of the conference. It is very important for all the global integral beauty community, the top of aesthetic global integral beauty community. So are everyone who are ready to elevate their brand, to scale their name, their expertise to be one of the top. All the professionals who have the ability, the conscience and availability to invest in their position. Remember, you can be the best. Remember, you can get the high level education, but if nobody know you, nobody is going to find you. That's why Global Interior Beauty is here for everyone. We have this top leader. They are co-author of the book, but also they are ambassador and global interior beauty leadership. Also, the most important is to have the availability to work together. And this is a multidisciplinary teamwork in the health, wellness, and aesthetics. And also be sure for the future, remember, challenge artificial intelligence, all the new technology and all the new opportunities to working together. Today, this one is not only the seminary. During this experience, you will share something designed to help you. is help you to expand your visibility, elevate your position, and connecting globally. In the first panel, about we was talking about social media, the impact of social media in beauty. For us, this social media is amazing opportunity to connecting with the worldwide professional. I think the doctor is here, so I can stop because I want to continue with the schedule. So we're going to invite Dr. Stewart. Okay, following our schedule, we are inviting Dr. Stuart Diamond. Doctor, are you here?
I'm here. Can you see me? Can you hear me?
I can hear you, but I cannot see you. Okay, now I can see you.
There you go.
Okay. Can you see? Come back.
Yes,
Can you
yes.
see my slides?
No, yeah, it's like just 1 second. Let me introduce yourself first, and then we can share your slide. Dr. Diamond Stewart, uh, welcome to Global Integral Beauty Seminary. Uh, Thank you for your time. I appreciate your special time. I know that you are working and you stop all your work just to be part of this amazing seminary. Thank you and welcome. Could you please introduce yourself? Just 1 minute. We love to know more about yourself from your side, but you know better than everyone. So tell us, where are you located? Where is your practice location? What is your expertise? How many years experience?
Yeah. So I am a genitourinary surgeon. I trained in Manhattan at several different institutions, including Memorial Sloan Kettering. I've been practicing that for close to 30 years. And I'm also a certified longevity physician and currently getting my master's in longevity science from the Geneva Institute of Longevity in Geneva, Switzerland. I still am a full-time practicing genitourinary surgeon, but in the last 4.5 years, my wife, Noelle Diamond, and myself opened up NDA Medical Spa, which is situated outside Philadelphia. And now I am really actively involved in the longevity and regenerative space, and that's what we're going to spend some time talking about today.
Thank you, doctor. And also, I want to just invite you and introduce all the community that Dr. Stewart is our advisor board too. Thank you for your cooperation. Thank you for your special work that we are here to work all together with you.
Well, thank you. I have tried to share my slides. Can you all see my slides?
See, let me see. Yes.
Yes, we can see your slides.
Yes.
Okay. All right. So are you guys ready to learn some interesting stuff?
Yes, we are ready.
We're ready.
Something different. We are ready, of course.
All right. Let's get right into it. So obviously, I'm passionate about what we're doing. The first slide I always like to show is this slide. So this is a picture of myself and my wife on the left-hand side about 9 years ago in Madrid. And the slide to the right over here, the new one, is 2 years ago in Saint-Tropez. Everything I'm going to be talking about today with you is something that myself and my wife, Noelle, have put into action, whether it's hormones, GLPs, skincare, diet, peptides. We are the petri dish for everything I'm going to talk to you about today. So I'm not going to just be lecturing you theoretically. We're going to be talking about real-time things that we can do. Beauty is just not skin deep. So what's happened in a lot of people in the aesthetic world is, sure, they look great on the outside, but inside they don't feel good. So our plan is to both complement what you can do on the outside, what you're showing to the world, how you look, how you appear, how you dress, but also be able to complement that by feeling great inside. You actually can turn back the hands of time if you find the right facilities and the people to do it. What's really important about aesthetic medicine today for me is we have our clients in our spa. You have time not just to discuss their aesthetic plan, But while they're there, really start tapping into how are you feeling? Not just how do you feel about your skin line or how do you feel about how the Botox is working or the fillers, but really how do you feel inside? Try to uncover their inner biology, because we have a unique position. We have these clients kind of with us for a good amount of time. They're electively coming to see us. So we do a disservice to these clients if we're just focusing on their pure aesthetic care, because we can help them internally with their internal biology. By helping them with their internal biology, you're also going to be able to complement their external biology. And I like to show this picture, not just because my wife is beautiful and I've gotten better looking because of her, but really to show people what you can really do if you put your mind to it and take several steps in the right direction. Everything about longevity and regenerative health is the concept of preventing diseases and underlying pathologies before they show up. Traditional medicine is just waiting for those diseases to show up and then treating them. Well, we don't do that with aesthetics, right? We don't just wait for the lines to get worse and worse and worse. We're treating frown lines, facial rejuvenation much earlier than we ever did. And we should be thinking the same path for aesthetics. So let's chat a little bit about what we're going to try to capture in a very brief fashion, because I don't have that much time, but I'm going to tickle your fancy, get you interested, and maybe open the page to a door you never thought you could walk through. And of course, I'm always available for further consultation or more education. So we're really going to tap into some of our underlying biology, and you must start looking at hormones, which is crucial. We'll talk a little bit about the phrase of early detection, not waiting for the diseases to appear, but preventing the diseases from ever appearing. And obviously, the earlier you do this, the more likelihood you can prevent diseases. And we're talking about longevity isn't just about living longer. It's about living longer and healthier. So it's not just living to 100 for the sake of living to 100. It's taking how you feel at 50 to 60, pushing that back to 60 and 70, how you felt in 67 and pushing that back. So it's able to live life fuller and longer, not just living life longer for the sake of living life longer, because no one really wants that. You want to live a productive life, whether it's traveling, spending time with your grandkids, whatever those things look like to you, because everyone's longer life is individualized. That's what you can do with simple steps and starting it today, not waiting for tomorrow, but starting it now. Precision medicine, that's where we're really going to hone individually. Much like your client who comes to see you for fine lines and wrinkles or weight loss or laser skin resurfacing, everyone's desires, drive, and needs are individualized. As such, you need to approach your patients in an individualized fashion in this space as well. And obviously, people are needing to work longer hours. And how do we achieve that as we're getting older, as some of the things, our energy, our focus, our attention can diminish as we get older, but they don't have to. When we talk about aging, these are the 12 hallmarks of aging. There originally were 4 hallmarks of aging. These are 12 and they're now 15. So these are just things that we can look at in our individual clients, whether it's right telomeres. Telomeres are the caps on top of your DNA, and they will shrink over time. But there are real-time actions you can take today to help hasten that shortening. I don't mean you can prevent the shortening, but you can reduce the ability of that shortening, and that has been shown to be a direct correlation to longevity. Muscle atrophy, which is a common thing even more with the GLPs. As we get older, we get what's called sarcopenia. That means our muscle mass will continue to decrease every year about 5%. With the GLPs, that actually can increase. So we're looking at things to control that. Mitochondria, very important. That's the powerhouse of the cell. So these are all different things we can look at in each individual person's body and put plan of action in to reduce this. When we talk about the longevity equation, it's made up of many different things. Our metabolic health, as I mentioned a second ago, our mitochondria, muscle mass, brain resilience, hormone balance, inflammation control. It's not one thing that's going to make you get to the end of the race. It's a marathon that takes into account many, many different things and functions. And there are physicians out there that can help you on the pathway to figure these all out. It's not just going to your primary care doctor. Primary care doctors are interested in just one thing, treating the acute issues that you have at hand, not preventing the diseases from the future. And we can do that. The pillars of longevity medicine, as I mentioned a second ago, it's all being proactive, looking at what the mitigating sources are to potentially affecting your well-being, enhancing physical, cognitive, and cellular function to maintain your vitality. And obviously, as people are improving, looking at their aesthetics, we want to improve the same kind of potentials inside their inner biology. One of the first things I always talk to our patients is looking at your biology. Before patients start jumping onto the bandwagon of peptides and supplements and shark cartilage and red light therapy and shock therapy and cold plunge, which all can have a role in your care, one must look at your biology. You cannot bypass your biology. God put it there for you to understand, and we need to uncover that. So before I start jumping on these new novel therapies, one must look at one's biology, and that's whether it's hormones, or we offer a very comprehensive lab testing panel that can look and do a deep dive into many, many underlying pathologies. For example, there is a blood test called ApoE. This is a blood test that can predict the risk of Alzheimer's. It's a one-time test because that can never change, but a lot of people don't even know this exists. Now, you can't change the potential of Alzheimer's disease, but what you can put into play, if you know this now and you're young, are things that potentially can delay it or actually prevent it. So these are things that most people don't even know exist. I didn't even know these tests exist until about 4 years ago. But one must look at one's biology before moving on to other factors. All the other things I mentioned a moment ago, the red light, the cold plunges, saunas, they all have a role, but they're additives. They're not the basis of your underlying biology. So we really look at your hormones out of the gate, and hormones are very important for all these things that you can see below you. When we talk about testosterone, and everything we're going to talk about now is hormone therapy for men and women. Most women don't even know that they even have testosterone, and they don't even know that it's something that they need. At one point in women's lives, they had more testosterone than they did estrogen. So this is a topic we're talking about to men and women. For testosterone in general, some of the signs are low energy, decreased libido, problems with focusing and brain fog, which is very common in both men and women, lower recovery from working out, increased body fat. So by supplementing testosterone for both men and women, it improves muscle mass and strength and energy and duration, and really is a crucial, vital aspect of longevity and regenerative care for both men and women, and one of the things we must look at. Estrogen is equally important. You may be familiar with, and I hope you do, most women should know, in November of 2025, finally, the FDA did remove the black box warning on estrogen therapy for women. And this has been a kibosh since the 2002 paper by Women's Health Initiative, which kind of stopped, unfortunately, the use of estrogen, a very poorly designed study, which took 23 years to get reversed. I still have to explain this to women who are very worried about taking estrogen, but incredibly safe it is doing the right path of treatment with physicians that know how to treat it well. The other thing that is a very important thing is most women, when they tell me they've had their lab works, they were told by their physician that the lab works are normal. Most levels are not normal. They might be therapeutic, but as women get older, their levels go down. So that is what they call normal, but it's not normal. And we really want to optimize our clients, both men and women, men mostly for testosterone, women mostly estrogen and testosterone and progesterone. And the combination of these things really can have a dramatic effect. For women, it's also important because the use of these medications, testosterone, estrogen, and progesterone, can help prevent Alzheimer's disease. Very important for cardiac stability and disease, bone density issues, and all the traditional things that develop as women are approaching menopause. And the crucial thing for women particularly is to really start these therapies well prior to menopause or perimenopause. My wife is 42 and she's been doing these treatments for close to 3 years. So you can start them after menopause, but you lose a lot of the benefits that you gain by starting it before menopause. So it's something really very importantly stressed at. Progesterone is the other third additive we really like to do. It's incredibly important for sleep. and it helps with anxiety, mood swings, things of this nature. So hormones are really a very important thing that we do. There's multiple studies looking at the effect of hormone optimization for men and women in terms of improving lifespan and health span that have been published in excellent journals, including the New England Journal of Medicine, Nature. So this is documented stuff. Unlike some other things in longevity, for example, like peptides, which there's few and far studies, this has been well documented. And I really encourage every man and woman to get their levels tested and to be assessed by someone who can understand the options, the pros, the cons, and how you can optimize yourself for a better life, both from the subjective complaints of low energy, fatigue, night sweats, and fogs, to then the improvement of the objective things, like I mentioned, heart disease prevention, Alzheimer's, things of this nature. My wife and I were honored to be elected and won an award this year for our platform for hormone imbalance for men and women called Equinox Unlock Your Biology. The testing is very simple to do. You can do at-home testing, anywhere, anytime testing we like to talk about. There's two different ways that we do it. We do it with what's called a blood spot test at home. Literally, you prick your finger and drop it into these little circles and then literally mail it in. And the newest form we're doing is what's called a Tassio system, where you literally place it right onto your deltoid. You hit a button and it draws blood right out of the capillaries in your muscle to a little micro vial that you mail in. So it's very easy. You don't have to go to the lab. You can do it at home. And when we do this testing, we also give you a questionnaire to fill out. In that questionnaire, it's going to ask you a ton of different questions about energy, focus, attention, brain fog, because it's not just looking at your levels, it's looking at how those levels are reflective of your subjective changes. So simple to do, easy to do, and then we're off to the races. It might be an oral pill option. It might be pellets, which you can place into your lower buttocks, which lasts 3 or 4 months. It might be a gel or a cream. It might be a troche that you put under your tongue, but there are tons of options available for our clients. It's just opening the door, stepping through it, and finding out a world of measurements and options that are open to you. And all the therapies that we offer are called bioidentical hormone therapy, meaning they're made organically, usually from sweet potatoes. And they're also the identical formation of the natural testosterone, estrogen, and progesterone in your body. So simple to do. HRT or BHRT is really important for a lot of things we just discussed in terms of the underlying biology. And obviously, this also can affect the aesthetic integrity of your skin, your collagen in your body. So it also has an aesthetic benefit as well. As your face is starting to droop and get signs of age, the same exact things are happening in other organs of your body. So it's, again, let's not just focus on the aesthetics, which is important, but let's focus on what the outside appearance is showing us internally about our own bodies. Some amazing things you can do. This is looking at your system age. So this is a test which is made by Generation Labs. Basically, you look at your chronological age. That's the age you are. You can never change that. And then we look at your biological age. That's the age of your internal body. Ideally, you always want your biological age to be less than your chronological age, because that can predict your mortality, and that can predict longevity and lifespan. This test used to be only 19 organ systems. Now it looks at 23 organ systems. It's going to look at the rate of each of these organ systems, how they're aging and how they should be aging. So for example, in this patient, this is looking in the red areas or areas that you want to work on. So this patient, for example, his chronological age was 38. His system age or biological age is higher. So we don't want that. We want to reduce that. Basically, what you do is when you do this test, you look at the areas of concern that would be in red, and then you're able to click on these different buttons of your organs that are being tested and get a real plan, an actionable plan. The plan for me is going to be, different than the plan for John. You place these actions in under treatments, and then you can look back and see how you're doing. You can repeat this test and then look at how you're aging, and if you're able to return the aging to a lower situation. This is a great example of that. This is a patient whose chronological age is 62. His biological age or system age is 60. We did a few things for him. Didn't make a whole change, but then when we put a more aggressive plan into action, you can see he's still 62 because that's his chronological age. But now we're able to look at those organ systems that were aging too quickly and put real plans of action in and reduce that. So this is an incredible test because it doesn't just look at your biological age and chronological age, which is a lot of DNA methylation tests out there that do that. This is a test, that's going to look at all 23 organs and be able to break it down to which organs you need to address and look at closer, and then repeat this test and see how you're doing. So it's really an incredible breakthrough. The woman that developed this is a PhD from Stanford. Another incredible technology is called VO2 max testing. We are currently partners with Duke University in this test, and this is an incredible test. So VO2 max testing comes in two forms. One is a resting form, which I'll show you in a second, which is looking at resting metabolic rate. The other one is when you're basically doing an all-out kind of bicycle test, maximizing and looking at the ability of your body to take oxygen out from the muscles. It's looking at maximum oxygen consumption. And there was a paper in 2018. In this paper, excuse me, I got ahead of myself there. Sorry about that. In this paper, they looked at all-cause mortality, diabetes, high blood pressure, heart disease, all these different things. And what they found was maximizing your VO2 max was the most important thing to reduce all-cause mortality. So if anyone is out there and going for longevity, if you're going somewhere that's not doing the VO2 max testing, you must get this done. In my mind, this is the top of the pinnacle of the pyramid, because then everything else we do can support this. And when they looked at this study, basically what they found is if you had a kind of a poor VO2 max test compared to an elite level, the mortality rate dramatically decreased as your VO2 max improved. Basically, when you do this test in the office, you're basically connected to several different things. A mask, which is measuring oxygenation and CO2. We have a wristband, which is measuring mitochondrial function in your muscles. The new technology we have also at the top of his head, we put another monitor, which is measuring blood flow. At first, you do the resting test, which is going to look at metabolic resting rate, which can diagnose metabolic dysfunction. And then you do the more aggressive test, which is really going to measure that VO2 max. And the same concept. It might be that you're a diaphragm breather. It might be that your respiratory rate isn't good. We take this information and we put an actionable plan in for you, and you can improve this. So this is a reproducible test that you can improve with testing as well as treatment and advice. It's incredible. We're going to quickly shoot into peptides for just a few minutes because I know we're getting close to the end. Peptides basically are short chain amino acids. Long chain amino acids are proteins. So for example, insulin is both a peptide and a hormone. All the GLP medications that were now very popular, those are peptides. The idea of the peptides is as we get older, the signaling between cells just doesn't work as efficiently as we did when we were younger. So the idea of peptides is to kind of improve that signaling or improving the message between cells so they work more efficiently. Peptides can be used for many different things: faster recovery from injury or from working out. They can help reduce inflammation. They have incredible inflammatory properties. Better sleep, which, as you know, is one of the pillars inside the world of longevity, and actually improve focus. So these are all additives. Again, we must look at your biology first. They come in many different names and forms. I won't belabor them. At the end, you'll see a QRS code where you can learn more about them. But whether it's looking to increase muscle mass or injury or recovery, they're very, very helpful. With the peptides, you have to cycle on them for 2 months, whichever one you're taking, and off them because you still need the body to continue signaling on their own, and the body doesn't want to get lazy. BPC is 157 is a very popular one for injury, 500. And again, on the QRS code, you can see a lot about these things. Copper one is a very popular one. It's great for shining of your skin. I do that one every day, and for your hair. MOTC is one that's really important for longevity. It has some function on mitochondria in terms of getting rid of dead mitochondria, which is one of the pillars that we look at. PT-141 can help with sexual arousal. Then we also talk about the GLPs, which are very popular. With the GLPs, as we mentioned earlier, they're going to affect your muscle mass or increase that sarcopenia, or the ability to lose muscle. So we have to take that in consideration. And that's why combining it with hormones, as we talked about earlier, is really crucial for these clients, because they're losing some of that muscle mass. And as you saw earlier, the testosterone can really help, and estrogen can really help with these things. So I really encourage. And then we talk about stacks. These are stacked peptides, where there's multiple peptides in one vial. So you're getting a lot of added benefits. Instead of multiple individual injections, you're getting a lot of added benefits. And these are many, many ones. I won't belabor the point because they're very, very interesting. But on the handout you'll have, you can see these, and you can always obviously reach out to me and do a deeper dive. But there are many, many different ones. They're really fascinating. The FDA probably in July is going to be removing some of the warnings that are out there on these medications. So stay tuned for those, because they'll be out very, very soon. The last thing I really wanted to shoot into is NAD is a very popular thing. NAD is not a peptide. What NAD basically does is stimulate ATP, or the gas of the body, and it has many, many different things. It can help with mitochondrial function. Oh, I'm sorry. It can help with mitochondrial function. It can help with repairing DNA. It can help with cellular signaling, improving the signaling, kind of like peptides, and metabolic function as well. And then lastly, it also can help with cellular resilience. Lastly, supplements are fantastic, but how many supplements should you take? You really want to find someone that can look at, for example, your system age testing, your VO2 testing, your biology. Instead of taking a bag of 50 supplements that you read about on Instagram or someone sold you, you can focus on the supplements that you need. This is all about individualized therapy. So really, you can focus on the supplements that are going to work best for John or Stu Diamond or whoever. So we really want to focus that down. I know we went through a lot in a lot of time. We didn't have a lot of time to chat, but I just wanted to share some of the global things that are happening in longevity. It's an incredibly exciting field. It is the internal biology, which is then reflective on our external biology, the biology that everyone sees us every day. As being in the aesthetics field, we have a great opportunity when our clients are with us, and we have some time to capture their attention, to start letting them know what they can do internally in their biology, because it's not just about looking good on the outside and feeling bad on the inside. You can do both. So I appreciate your time, the opportunity to chat with you. And again, here are some of our contact information. I'm always available to chat and educate even more. So thank you very much for your attention and your time.
Thank you, Doctor. I really appreciate the amazing information, all the new technology, all the new information about peptide that is very trending. It's very clear, the information. I have a question from you. We have a question here in the chat. Could you talk a little bit about the side effect of this treatment?
Which treatment are you referring to?
Let me see, because I have the question here from Dr.
And I want to apologize because I'm originally from New York, so I tend to speak fast. So I apologize if it was too fast. But again, feel free to reach out to me directly, and I'm happy to answer all questions if we don't get to them today.
Okay, so no problem. Is the Dr. Olga? So Dr. Olga, are you ready here for your next presentation? Is going to be the panel. I think the doctor is mute. Okay, she have a question here in the chat, but she is not here now. So thank you. So where we can contact you? This is all your information to contact you through through your social media, your location, the clinic location. If we need more information, we can call you directly to your clinic.
Yeah. So I have listed here the peptide blend menu. That's the one where the multiple peptides all in one vial. And there's some incredible things. Obviously, the one NDA spa is to the right. And then I wanted to mention, I post every single day on LinkedIn about longevity. So there's all kinds of interesting information if someone wants to follow me on there. I hope it came across. I'm very passionate about this because there's some amazing information, but there's also a lot of misinformation. And I really try to weed through that for people. I can't tell you how many clients we see that randomly just bought something on Instagram, a peptide. If you're going to put something in your body, whether it's a supplement or the peptides you have to inject, and the GLPs you have to inject, you should know where you're getting that from, where it's being sourced from, what kind of compounding company made it. Is it FDA and 503B approved? So I often caution people, be careful what you buy, because you really need somebody who understands how they interact with your body, how they interact with your regular medications. If you're not feeling the right way, how to look and treat the potential side effects of anything that you're going to do. So I'm not saying come to me. I'm not saying that at all. Please find a clinician or someone who knows what they're doing, because you don't want to put something in your body that you know where it came from, where it's sourced from, because ultimately it can affect you.
Thank you, doctor. Now we're going to follow with short video, and the next panel is going to be longevity and preventative aesthetics. Doctor, you are welcome to be the moderator too for this panel. The video, please. I'm Idalis Bailey, best-selling author of Global Expert in Integral Beauty 1, 2, 3, and 4 edition in English and Spanish. I invite you to be part for the latest 5th edition on Global Expert in Integral Beauty. If you are ready to scale your name, your brand, and your expertise, this is the best space for you. If you want to be different in the industry and show all your community how important is your position, I'm waiting for you. Register yourself and be part of this amazing community. Thank you, and doctor, you are welcome now to be the moderator for this panel, and we have 3 guests. I think that Dr. Lisa is not connecting yet, so we can start it. If she's connecting later, we can do the question for her at the end of the presentation. Welcome, Dr. Stewart, and we have two present, 2 VIP guests. Is Dr. Olga Silverstein, and hi, doctor, how are you?
Hi, how
How
are
is everything?
you?
And also we have Noelle Brown's Diamonds, and she is an longevity expert. Oh, hi, how are you, Noelle?
Hi, how are you? I'm doing well.
All right, so Dr. Stewart is going to be the moderator for this panel. Welcome, Doctor.
Hi, how are you? I feel like I just saw you 2 minutes ago. Welcome to everyone. We just finished a longevity presentation and tapped into aesthetics. So before we even get started, would you guys just mind introducing yourselves, telling us a little about your background, your clinical experience, where you guys are working, and we can go from there.
Who's starting?
I think you are. You jumped right in.
Okay, my name is Dr. Olga Zilberstein. I'm a physician. I am practicing aesthetic medicine for the last 18 years. I am actually a pediatrician by training, and I've been practicing medicine for the last 26 years after residency. So aesthetic medicine definitely my passion, and I still practice medicine as well. So.
Okay, and I am Noelle Diamond. I am the co-founder of NDA Aesthetics and Longevity with Dr. Stuart Diamond. We are located in Moorestown, New Jersey, right outside of Philadelphia. And my background is as a registered dietitian, and then I also am very passionate with aesthetics, and we've opened a medical spa several years ago. And now we're really focusing in on the marriage between regenerative medicine and longevity within the aesthetic space. So looking good, not just from the outside in, but the inside out, and how those two things work together.
Great. Olga, my first question for you is going to be, from a medical perspective, how is the concept of longevity reshaping the approach to aesthetic treatments, particularly in terms of prevention versus correction?
Okay. So from medical practice, we all know that preventing diseases is much easier than treating diseases. And in aesthetics, we treat signs of aging. So what are the signs of aging? It's wrinkles, it's pigmentation, it's all what we see. But we know why we age, why our skin age. It's not just genetics. It's now we know that our lifestyle is actually around 80% contributing 80% to the aging rather than just 20% is your own genetics. So what is the lifestyle? Lifestyle is mostly what we eat. It's easy what we eat. Well, that's what we consist of. So the SAD diet, which is just average American diet, is actually full of unwanted fat and sugar. We actually, Americans consume largest amount of sugar, and we know that sugar causes glycation of the collagen, which is the main protein in our skin, which is we lose collagen over the years, and the sugar and all this lifestyle contributes to the decreased amount of collagen in the skin. So speaking about nutrition, ultra processed food, it's kind of common knowledge, but it's I just wanted to emphasize how important to eat a healthy diet. A Mediterranean diet would be full of fiber and vitamins, and how it's contribute to collagen preservation. From biochemistry we know that for collagen stimulation we do need vitamin C, and if you want to supplement, have one supplement, I think it's the most important supplement, vitamin C, to have to promote collagen production and decrease the reduction of collagen. So I talk about healthy diet with my patients, and I talk about prevention of collagen destruction from sun, ultraviolet sun. We know it's destroys your collagen. It's so many pictures circulating internet of people who exposed to sunlight, like truck driver exposed to sunlight, and half of the face is completely wrinkled and the other half of the face is preserved. And we know that sun completely destroys your collagen. And this is number one. Like I always tell my patients, if you come for treatments, preventative treatments with Botox and fillers, but it's just like going to dentist and doing treating your teeth, but you need to really brush your teeth at home. So it's the same thing with sunscreen, preventing destruction of the collagen, and working on your part at home. So we're talking about lifestyle. So we talked about nutrition and sun protection, because oxidative stress is a major thing which kind of really destroy our, of course, all this. It's like, I feel like much less people smoking right now, but we know that smoking not just cancerogen, but it also destroys your skin. I can see across the room if the person comes in. I can see that if they're a smoker, if they expose themselves to sunlight. It's really written on their faces. It's written on their skin. So we talked about nutrition. The other factor in your lifestyle is exercise. It's extremely important. Your exercise, it's increased blood flow for the brain. It's actually number one factor now for preserving brain function is exercise. And the same things happen with the skin. It's extremely important to exercise, and it's also great for your skin. And one more factor of the longevity in general and skin preservation is stress management. Stress, lack of sleep destroys your skin. It can cause chronic inflammation in your body, and it's also going to be written on your face. So meditation. We can't avoid stress. It's in everybody's. It's kind of something hard to kind of prevent. If it happens, it happens, but your how you manage the stress, that's what important to do. So meditation, sleep management, prioritizing your sleep, you're prioritizing circadian rhythm. That's what important.
No, I
So
mean, those are good points.
yeah.
I mean, everything we talked about, we just talked about shortly before you all came on, was the external biology being reflective of the internal biology. So everything you just mentioned affecting the skin obviously affects everything in your body. Exercise, we just finished a whole talk about VO2 max and RMR baseline testing, stress, brain. I mean, everything. The whole point was that what's reflective on your outside is reflective on your inside. So as the good that you're doing for your skin, which you just mentioned, all amazing things, those internal things are going to be incredible as well. So those are all excellent points. Noelle, from a longevity standpoint, how do internal factors such as inflammation, metabolic health, and stress biologically manifest in the aging process of the skin?
Well, I like to say that skin is not just a canvas, but it's a biomarker as well. So, as previously touched upon, you can really see it on a person's face and just the skin all over their body if they're in a well-fed state. That doesn't mean overfed. So, there's a lot of people who may be overweight but undernourished. And so, it's important to look at those factors as well. When you're looking at the biology, that's everything that's going on inside of the person's body, we also need to take into consideration hormones. When women reach menopause, that first year after, 30% of their collagen is lost. And you can see that manifest on the skin. So it's really important to support the body with estrogen and with testosterone to help keep those cells healthy and regenerative. We don't want to just keep cells around for a long period of time. Most of the time, we're trying to do the opposite in aesthetics, right? We're trying to use retinols and vitamin A to increase the cellular turnover to have new healthy cells. So it's important to have the building blocks of proteins, sometimes perhaps peptides and hormones to be able to give that skin the support that it needs. I also like to recommend a lot of the times people consider biostimulators with increasing that collagen synthesis, especially with now the fact that 1 in 8 Americans is on a GLP. GLPs are wonderful. They decrease inflammation. And as we said earlier, inflammation is really one of the #1 causes of aging. Rosacea is an inflammatory condition. Acne is an inflammatory condition. So by treating the inflammation in the body, you can really improve the health of the skin, but only when it's well managed. If the patient is not well nourished and they're underfed while on these medications, you will see the aging process accelerate through atrophy of the muscle in the face. So a lot of these muscles here that help you smile, they'll be attacked as well, and the face will drop. You will see gels here, and you'll see thinning of the skin tissue. So all of these things need to be taken into consideration.
So, a quick follow-up on that. Olga had mentioned how she addresses her clients there about diet, smoking, and skin. How this is kind of entering a different field, talking about their hormones, because they're not necessarily there for that. So, how do you approach the conversation with these clients that are in the chair coming in for fillers or Botox, everything you just mentioned about looking at hormones and whatnot? And do you find the clients receptive?
Yes. I would say it's on our intake form. Not only what are your concerns? Are you concerned about wrinkles or under eye bags? We also have on there subjective questions such as how do you feel? Do you sleep well? Do you feel like you have brain fog? And by looking at our intake form, it opens up the dialogue with the patient and it gets the patient thinking as well. Most of our patients are females 35 to 60. So most of them would benefit from some sort of hormone support, and it's pretty easy to open that conversation. I also think now with social media, which is great, they're really opening the conversation. Perimenopause is one of the most trending topics out there right now. Women are seeing that they're not suffering alone anymore and that they don't have to suffer in silence.
That's great. Thank you. Olga, what emerging scientific evidence supports the integration of regenerative or biostimulatory treatments as part of a long-term preventive aesthetic strategy?
Okay, so biostimulators, some biostimulators, they are not that emerging. We've been using them for, I've been using them for the last 15 years, such as Sculptra and Radius, which is they're biostimulators. They stimulate collagen production, and they FDA approved for stimulation of collagen and volume replacement. And the latest study in 2024 with Sculptra PLLA actually showed regeneration and collagen production and even blood vessel stimulation, improving the luminosity of the skin. So we've been using those FDA approved regenerative therapy for years and years. And I've always been big enthusiast and supporter of all natural aesthetics. I myself hate anything unnatural on the face. So this is my workhorse in my practice, been for a while. So now we have emerging new, less studied, I would say, players such as polynucleotides or PDRN. It's a salmon skin DNA particles which actually regulate gene expression and promote tissue regeneration. I would say they are not as good studied, and the latest, I just looked up the overview of the literature on efficacy of PDRN is actually half of the article saying, oh yes, it helps, and half it doesn't. I think the regulation in the area is very sparse, like it's so many companies producing PDRN, and it's mostly overseas. It's like Korean companies. I love going on to international conference. I just went to a huge congress in IMCAS. It's the probably biggest world congress. And it's so many different PDRNs and polynucleotides. And there is no really regulation on that part. Nobody checking what is there, what actually, how it's done. I feel like it's a wild west out there, and it's definitely not FDA approved in any form for injection. We do use for microneedling. It's the most what we can do. I would like to stay compliant. I don't want any problems. It's also, I've seen huge side effects when people inject PDRN and create immunologic reactions and allergic reactions. We definitely want to avoid all those things. We want to stay safe, and that safety of the patient is a priority out there. So same thing with exosomes. Exosomes, that's a collection of growth factors, proteins, some messenger RNA. It's a genetic material, which is not FDA approved, definitely not FDA approved for injection. Some studies shows that it helps regeneration, it helps production of collagen. I do use it after my energy-based devices, and I do see improvement in healing and even in optimal results enhancement from those procedures. But again, it's not FDA approved for injection. There's some people injected, even infuse IV, and I feel it's very unsafe. We don't know what we're doing. We don't know. We don't have safety profile. As a physician, I feel like that's the most important, not to harm my patients, not to give any false promises. So it's emerging. It's very interesting. It's a big buzz out there about those substances, but the data is still emerging. So the most important is safety profile. I didn't mention I didn't mention our PRP, PRF, platelet-rich fibrin. I use a lot in my practice. It's I feel it's very safe to use. It's a biological product, but it's from the patient, and we do see improvement. And the studies also like confirming of efficacy of regeneration, of collagen stimulation, and healing with your own platelet-rich plasma or fibrin. The other thing which regenerative aesthetics, it's all the energy-based devices. Energy-based devices, it's laser, fractionated laser, radiofrequency microneedling, even microneedling. What we do, we create calculated injury to the tissue, and it creates a cascade of regeneration. And it does work. There's numerous study, it does work. And especially if you combine it, actually, I see with my exosomes, it's healing goes much faster, and we get great results and regeneration. So it's all been used, and like I said before, prevention is always better than treatment.
Yeah, I agree with everything you said, and we're back your philosophy up. I mean, you have to stay within the realms of safety and regulation. And when emerging technologies come out, it's not the best to jump on board and push the envelope without safety behind. So everything you just mentioned about PRP, exosomes, skin pen, microneedling, we're on the same page. We are not in the position, nor should anyone be in the position of pushing the boundaries of safety. And that's why those boundaries exist. So we play within the playing field we've been given. Noelle, how can integrating longevity protocols such as nutrition, supplementation, and lifestyle optimization enhance the outcomes of aesthetic treatments in a measurable way?
So aesthetic treatments are only as good as the body is able to respond to them. So if we're trying to do something regenerative, if the body is inflamed, undernourished, or really hormonally imbalanced, you're not going to respond in the same way. Same thing like when we were talking about PRP, PDRN. The quality of that is only as good as the quality of the blood supply. So if the patient is undernourished, it's not going to have as beneficial and efficacious a result as someone who is. So I think it's really important to look at all those things, because as we're simulating the body to repair itself, it needs to be able to. And I do find that in our practice with our patients who are not well balanced or undernourished, they're not getting the same results as the ones that are. I think it's also important, we're getting back with the GLPs. We've also noticed that patients who are on a GLP are less responsive to Sculptra and more responsive to Radiesse, because Radiesse does not rely on the inflammatory response the way that Sculptra does. But I love Sculptra with the right patient, and it's really been great for regenerative and improving your collagen and elastin. But again, it just has to be dependent on the health of the patient as well. It can only do so much. And I do really agree that pairing the radio frequency devices with those things that we inject internally has a great combination of a result. And that way we can see things that are measurable as well and not just visual.
That's fantastic. You guys did a great job. Can I each ask one of you each to give me just a 45-second snapshot of what future exciting thing, well, quickly, exciting things you're looking forward to coming down the pipeline in both your fields?
Well, I actually listened to your lecture on hormone replacement therapy and peptides. This is something extremely interesting and exciting. So this is something for me yet to learn and understand. So maybe I'll contact you at some point. So I guess that unknown area for me is very interesting and exciting. Yeah.
Noelle?
Hi, everybody. I think for new things that we can look forward to as a licensed esthetician and educator is that the information travels down the pipeline from the doctors all the way to the estheticians to kind of know, again, what's in your parameters of working with the skin, even if you have a medical director, if you don't, because at the end of the day, the educational aspect is the most important thing for, I think, physicians, estheticians, everybody in the beauty industry. And so what's exciting for me always is just knowing that that education can be trickled down to estheticians. So for one, they stay in their scope. Like Dr. Diamond was saying, you know, I think that's super important because once estheticians push the envelope, that's how things are taken away. And then people get hurt too. So for me, education is just the most important thing that I always look forward to, from nurses, doctors, beauty industry experts, like brand reps, even learning about the product, the protocol. And like Dr. Olga was saying, you know, you don't even know if some of these things are FDA approved or not. So that's really important as well. It's like knowing what you're using and when you're using it and how to use it, and then what to combine with it to get the best result from education, the tools, everything else that is at our fingertips. So I think that's kind of what I look forward to.
Noel?
I totally agree. I think that the science that is emerging is so exciting. There's lots of studies out there with applying rapamycin topically, for instance. There's a great serum that's already out. Having all of this data and using it in a practical way that people will actually use to improve their results. A great example I like to use is I really do like Nutrafol, but some of my patients, I ask them, how's it going with the Nutrafol? And they'll tell me, it was 4 pills. It was too many. I stopped taking it. And then when I said, well, you could have just taken 2, and they go, oh, I didn't think about it. So if you give people too many steps, too many things to do, they end up doing nothing. So I'm really excited about the science that's emerging to give us the data to improve ourselves from the inside out with the things that we were talking about with hormones and peptides, but also some of the new topical products that are going to be coming out.
Well, this has been amazing. I've learned a lot. I'm going to leave everyone with 2 sentences. What today's discussion made clear is that we are witnessing a meaningful evolution in aesthetics, one that is grounded not just in appearance, but in biology. And lastly, aesthetics is no longer just about how we look. It's about how we age. Thank you all for attending, and appreciate all the panelists for joining us.
Thank you.
Thank you.
Thank you very much, all the speaker today, the international speaker. I really appreciate your time, but also is a really important time to recognize everyone, the necessary to work together. Multidisciplinary. That's why I love the way we are doing here in Global Interior Beauty. For Global Interior Beauty, all the professionals are necessary. It's a complement because we have all the non-invasive treatment, minimal invasive treatment, and invasive treatment, and all the treatment needs to work with all the things: esthetician, nutritionist, psychology, doctor, aesthetic doctor, plastic surgery, dermatology, and that's the best way how we can connect together. And this panel is an exact example that we are talking about. Thank you very much, and I appreciate your expertise, your information, and your time too.
Thank you.
Thank you.
Thanks.
Follow with one short video, and it's coming, Dr. Niels. Dr. Niels is a board certified plastic surgery.
Here we are with Dr. Lana. She's been part of this 4th edition of Global Interior Beauty. How are you?
I'm so good. I'm so excited. I came here to have fun, party, to network, to elevate, and that's exactly what we're doing.
Yeah, we're having so much fun. But you know, you are inspiration for a lot of women. And I want to know, what message could you give to them so they can be part of this conference that is so important?
You know, this conference is all about hearts, love, elevating each other, women empowerment, also men. I think it's important that we understand what the new trends are that's coming in, but it's also amazing to network and be in the same room with movers and shakers that can get you to the next level. We all need a little bit of motivation every single day. And when you come to this Global Integral Beauty Conference, you get people from all over the world globally to help elevate you in your everyday life.
Thank you, Doctor. Welcome to Global Interior Beauty Seminary. Dr. Niels, we've invited you to introduce yourself because you know more than us, and explain to us where are you located, your expertise, your year experience. So we would love to know more about yourself.
Excellent. Well, good morning, everybody, and thank you for having me. I'm not sure if this is just my screen, but it looks like the name is backwards or mirrored.
And
So,
that's the way that Zoom work.
uh,
I cannot see my name looks like the opposite, but that's the
got
way
it.
they
Well, I hope you guys can read it. And my name is Dr. Neil Vranis. I work in Beverly Hills, California. I'm a board certified plastic surgeon. I do a lot of facial procedures, facelifts, facial rejuvenation, such as fat grafting, blepharoplasty, rhinoplasty, revision rhinoplasty. And then I do a little bit of also body work too. So some breast augmentations, mommy makeovers, liposuction, body contouring, fat grafting to the butt for the buttocks for augmentation. So I do have a nice general practice, which keeps me entertained. I think it really helps also take skills from one part of the body and apply it to the other part of the body at times. And so the patients benefit from that. And also for being able to form comprehensive plans. When a patient walks in the door, it's very nice to be able to address all their concerns at a high level. I've trained at North NYU plastic surgery, which is considered one of the premier plastic surgery programs. It's pretty rigorous. And then I decided to do an elective 1 year fellowship in aesthetic plastic surgery out here in Beverly Hills. And the focus on that was revision rhinoplasty and facelifts and deep plane facelifts that all the talk around town is. And that's what we'll be talking about today also.
Thank you, doctor. Today the doctor is going to talk about achieving harmony and balance with facial rejuvenation procedure. Welcome for your presentation. So we're going to start now.
Is it coming up or am I supposed to do something?
Yes, the presentation is coming up.
Okay. Excellent. All right, so we got through the introductions and let's see here. Do I have control over the screen? Can we advance the slide? So the real question people ask is, facial rejuvenation. Someone comes into the office, they've been aging slowly and perhaps they've been taking their peptides, they've been doing all the right things, they've gotten some filler treatments, but at the end of the day, they, show up and they say, well, I look tired when I look in the mirror. And so how do we go from this to the next slide? Is there any way I can control the slides? And to go like this, right? So, she looks a lot more refreshed. She still looks like herself. So the whole point is how do we do this? How do we do it safely? How do we do it in a way that patients look in the mirror and they feel refreshed? Okay, next slide. So the first part when they come into the office is we form a comprehensive plan. We do an entire assessment from head to toe, from their forehead down to their neckline, and we look at everything. We look at the volume, parts that have been deflated with aging. So there's two major components with aging. You have volume deflation, where parts of the face lose volume, and then you have also descent, where actually parts of the face will fall down. And a lot of times people will focus on one or the other, but not necessarily both. So, injectors that can't do surgery obviously can restore a lot of the volume with fillers. But you can't really deal with the lift component of it. And then also separately, some surgeons that only focus on the lift, they try to do a 2 hour facelift, get in and out very quickly. They don't focus really on the volume restoration. They'll lift the tissue, but then they'll forget to do the volume augmentation, whether it's with natural fat, with fillers, or other augmented materials. And lastly, we got to look at all the different layers. So there's many different layers that go from the bone, that's the deepest surface, all the way out to the top. So a lot of people nowadays are looking at the SMAS layer. And where that came about was that initially, facelifts probably about 50, 60, 70 years ago, they would only focus on the skin. They would cut out skin, pull the skin as tight as possible, and then close the incisions. And what happens is that, a year later, the skin, it looks exactly the same because the skin stretched out again. And this happens because that's one of the properties of skin. Skin is meant to stretch out. When women are pregnant, their bellies stretch out, accommodate the pregnancy, and then as soon as they deliver, it snaps back like a rubber band. So skin is not a very good vehicle for lifting faces. And so we have to go a layer deeper. And so the next layer deep is what's called the SMAS, the superficial musculopeneurotic system. And so that's the layer that basically goes between the muscles and the skin, but it's a thicker layer, it's more supportive, and that's actually what causes the descent. So if you lift that up in addition to the skin, that's where you get the longer lasting results for faces. And then obviously we also have bony changes. And so that's where a lot of the volume then is going to be placed either superficially or deep, depending on what you notice in your examination, the comprehensive plan. So there's really good studies actually by Val Lambros that tracked aging over 30, 40 years and noticed that with aging, what happens is the mandible gets smaller, the eye orbit gets bigger, and that has to do because of bony resorption. So with aging, there's also a component of bony loss. And that's think about if you're looking at a house, you're not just looking at the roof needs a repair, the second level needs a paint job and restoration, but also the foundation has sunk into the ground a little bit. And so in order to get the house back to where it was, you have to also build at that foundation. So let's advance the slide, please. So that's how you do this. And so basically going back to our first example here, is we looked at it comprehensively. So we did a little bit of a brow lift, and you can see the lateral corners of her brows are elevated to a little bit more youthful position, doesn't look so sad. The, I'm sorry, I can't hear the question. So the brows are a little bit elevated. The eyes look a little bit more restored and youthful. Those bags under the eyes are taken care of and obliterated. She has a little bit more volume in the center mid face, that she had, again, lost over time. The deep plane facelift is a great way to restore the tissues in a higher position, exactly where they used to be. Restore a little bit her smile. You can see she's not frowning as much. She doesn't look as sad in her mouth. Fat transfer helps with that, restoring the volume, and then laser resurfacing to polish the skin. We like to say here that if you go buy a couture dress and you have beautifully designed, elegant dress, but then you forget to dry clean it and you see all the wrinkles, it doesn't you're doing a disservice to the manufacturer, to this elegant dress. And so the laser is the polish on top to really get the skin to be rejuvenated. All right, let's switch next slide. So this is what we're talking about, basically understanding the aging process. And so it's not a very simple thing. It happens in three-dimensional space. It happens over a long time. You have a lot of other environmental factors that you all have mentioned previously, whether it's smoking history, sunlight exposure, poor nutrition, malnutrition, stress overall, all for a stressful life that we live. And so all these things play a role. And so you'll see the bony resorption, you'll see the ligamentous laxity, and that's what then there's different tether points in the face. And so one of the tether points is around the eyes. You start to see that prominent circle around the eyes. There's a tether point there. And that's also when you see trauma happen. Basically, if you've ever been punched in the face or you've seen someone be punched in the face, you see how the blood stops in a perfect circle. That's because there's a barrier, there's a ligament, a strong ligament that goes between the eyes and the cheek. And so that prevents contamination from the cheek into the eye, and anything from the eye, like a hematoma or anything like that, down into the cheek. But that ligament is also then what tethers the skin at that particular point. And when you get older and you see that ligament, that bag form a little bit lower and lower into the cheek. That's that laxity that you can appreciate in addition to the soft tissue descent. So the midface, the cheek volume, is what's pulling down on that ligament and causing it to stretch down. And that's one of the zones of adherence. The other zone of adherence is here by the mandible. You have the mandibular ligaments, you have the zygomatic ligaments. So the face, if you think about it, there are a couple connections that go from the deeper layer of the bone to the skin, and those are called the zones of adherence. And so when you're doing a facelift, you have to release a lot of those zones of adherence. This is the whole premise of the deep plane facelift, is that you find the deep layer, and then you basically release those zones of adherence and then lift them back up, reconnect them in a higher place where they used to be when you're youthful, and then basically take out the excess skin. But that also goes to show, that I am always amazed at how much when you go find the right plane, you do half the dissection, you pull the face and up and it doesn't move. And then you go and release, once you do a complete release, then the entire face moves up. And so that always amazes me and fascinates me just how much work and how strong these ligaments are in order to get that sort of upward mobility. So let's move to the next slide. And then here's another example, very similar, same sequence of procedures. Basically, when you look on one side, when someone looks, might look a little bit more tired, a little bit more aged, a little sad. And so then, when you're able to lift the brows up a little bit, take out a little bit of excess skin from around the eyes, blunt some of the lid cheek junctions from the eyelids to the cheek, lift the lip up a little bit to create a shorter distance from the philtrum to the nose. That's another part of the aging process that happens. The lip gets longer as we age. And even lift the tip of the nose up a little bit. You can see with age, there's a rotation that happens to the tip of the nose. And so being able to reverse that is what in all gives a comprehensive rejuvenation look. The lip lift also not only shortens the distance of the lip to the nose to the base of the nose, but it also will rotate out the upper lip. And so you get a little bit more upper lip show. So you can see here, she goes from an upper lip that's very thin, some people call it a razor lip, to something that has a little bit more shape and beauty. And again, in a very natural, elegant way. We're not trying to create different humans here. We're not trying to put people in the witness protection program and, change their identities. The whole point here is to do a bunch of things subtly, but in total, they're comprehensive and will increase the overall aesthetic of the patient. So let's go to the next slide. So here's a couple more angles you can see here. Again, the list of everything that we did, which is very similar, except this particular patient, we added a lip lift because I thought her upper lip was a little thin, and I thought that was going to really help create an overall improved result. But you can see the improvement in the neckline. It looks a nice clean jawline, especially in the three-quarter view. You can see that it's been restored, and in a way that doesn't look pulled. And I think that's what happened back in the day when we were talking about the facelifts that were only in the skin. They would pull the skin as tight as possible. People then got that windswept look. They got the look that they felt that was, that a lot of people come in now, they say, oh, no, I don't want a facelift. I don't want to look like that. I don't want to look like I'm in a convertible and my face is like all the way pulled back. So the goal here is to do it in a way that's very natural looking. So let's go to the next slide. So touching a little bit on regeneration, and I like the previous panel that talked a lot about this as well. This is, I think, the future of plastic surgery, the future of aesthetics. I think this is why we're all here also. We got to talk about not just synthetic products, but we have to talk about everything. So let's go next. It should. Perfect. So we have off the shelf stem cells that some providers use. I personally do not use these. I am a huge fan of autologous. So I do harvest fat. I process it in a way that does basically take out all the fat cells for volume and leaves you just all the stem cells, the fat adipose-derived stem cells, the growth factors, the cytokines, all the secretomes, the exosomes that our body has. And so that's called the SVF. And so it's a process called nanofat. This was initially described in 2013 by Dr. Ternard out of Belgium. They've created a process of serial filtration and processing. I'll show you later on in the presentation how we do this. But at the end of the day, you're left with just juice. And so think of like juicing fruits. And so you're left with a water part, which can go through a very, very small needle versus when you're thinking fat transfer for volume, that has substance, it has volume, it has structure, stability, and it can't go through a needle. It has to go through a larger bore cannula. So that's how you know that you're getting two different things, in addition to the studies that show very nicely on electron microscopy and also on tagging different stem cell markers, all the CD30s and 45s and 90s that showed that when you do this, you have zero adipocytes and you have a large population of stem cells, viable stem cells. PRP, PRF is a great way for, draw blood and create autologous small amount of protein, platelet-rich plasma as well. That this has a lot of growth factors. It really lacks a lot of the stem cells. There are very few stem cells that go through our blood circulation. So it does lack that, but it does have good, healthy growth factors. Does promote wound healing faster. I do see that when I do, various laser treatments, microneedling sessions, and we augment it with PRP, it does improve and show, gets people are a little bit faster recovering. Exosomes off the shelf peptides that, we have some experts here on this panel that talked about the use of peptides and just again, holistic, if you improve your entire body, your ability to heal, obviously, these powerful surgical procedures are going to be a little bit better. You're going to heal faster. You're going to heal better. I really do think that. And then we augment healing also with hyperbaric oxygen, basically creating an environment in the body that has higher basically pressure and concentration of oxygen so that cells can heal faster at the cellular level. So let's go to the next slide. Nanofat. So this is honestly what I really truly believe I think is the very, very powerful. It's autologous. It's rich in SVF that we talked about. It's a powerful regenerative therapy. So let's go to the next slide, and I think we'll see some examples. So we do this in the office. We harvest it here. You can see she's wide awake, just a little bit of local numbing. And so you're seeing this go through a 27 gauge needle. It's amazing for under the eyes. Some people complain of the dark circles. It creates, I think, a little bit of collagen. It buffers the skin and the muscle that you're seeing the shine through, and that's a little bit contributing to the dark circles that patients will complain about. It also will restore the skin. And so there have been a lot of the studies that have been demonstrating the power of nanofat shows that it's really good in scars therapy. It's acne, burn scars, surgical scars. It regenerates the skin. It increases luminosity, elasticity. It restores volume. It decreases transepidermal water loss. So basically, there's two functions of the skin. One is to keep bacteria and foreign invaders out, and the other thing is to keep water and moisture in. And so the whole point of the skin is, those are the two functions. And so there's been studies that you can objectively compare the transepidermal water loss. And so this improves, shows that there's improvement in the function of the skin. And I think that's the key to showing that it actually is more youthful. And patients will say this all the time, at a month, 2 months after my skin quality got better, my parents, my siblings, my friends all said, wow, your skin looks better. And it continued. The interesting part, because it's regenerative, it actually continues to look better and better over 6 months, a year, 2 years later. It continues to look better. And I think that speaks to, I think Dr. Diamond showed earlier that, there was one of his biomarkers showed that 2 years later, she progressively got 9 years younger in her biologic aging markers. And again, I think that's what regenerative means. It means to really turn back the clock and keep turning it back, not just turn back the clock and then, stay there. So let's advance. Again, she's happy after, this is an awake procedure. It takes us, maybe a couple hours between the harvest, the processing, and injecting the entire face. But, they walk out, they feel great. They're bruised a little bit, I'm not going to lie to you. But it's a pretty tolerable procedure. Let's go to the next slide. Here's where you can kind of see a little bit where the skin luminosity looks better, the under eye discoloration looks better, the pigment improved, and the skin texture, the pores got smaller, a little bit of the fine lines got better. So these things are improving with nano fat transfer procedure, and that's what this particular patient had here in the office, awake under local anesthesia. Let's go to the next slide. Same thing here, male. Unfortunately, the lighting is a little different, and I apologize for that. He actually had fat transfer as well as nano fat. So you can see here that, he was pretty happy. He wanted a little bit more malar projection and cheek volume. And so while we were doing that, we said, listen, like, we're already harvesting fat. We'll just harvest a little extra fat, process it in a way, inject it with the nano fat, technique. And so you can see that, he did get decreased pore sizes. It helped a little bit, the inflammatory conditions of the rosacea. Again, if we're injecting in the areas of inflammation, of skin problems, and you're injecting a powerful regenerative therapeutic, I think that's where you're going to see calming of the inflammation, improvement in the melasma I've seen, as well as just the aesthetics of skin. Let's go to the next slide. And this is his procedure. You can see this is the cannula. It's a larger bore. This is for adding the volume, the fat transfer. It's very similar to anyone who injects filler. You're going to look at the same. You're going to do the same assessment. You're going to see where you want to inject volume and then grow from there. Let's go to the next slide. So understanding, and mastering anatomy, I think, is critical for any plastic surgeon, facial plastic surgeon, any injector, anyone in our field. You really have to know, like similar to a test. If you're going to do a test before and similar and after, you have to be able to compare a face before and after. You have to look at, you almost have X-ray vision, and so see what the bony structure looks like underneath the face that's in front of you. Look at the midsection, the SMAS, the muscles, how they're aging. And then look at the skin and look at the polish, look at the pigmentation, look at the pore sizes and all that. Creating a balanced plan, that's just my philosophy. I think I don't like doing things in the extreme. Patients don't come to me. Patients that want extreme things probably go to other surgeons. The ones that come to me want to say, hey, I don't want to look too pulled. I don't want to look too, ridiculous. I don't want to look different. I just want to look like I'm well rested. I want to look like I got a good night's sleep. And so I think my philosophy is doing a little bit in many different aspects of the face. They all come together, they balance out and create a harmonious result. So you have to consider the deep and superficial. And then again, overall, doing less in multiple areas translates more overall. I do think regenerative is the future. I do try to combine it with lasers or nanofat, PRP, things like that we have at our disposal. And I think that's the conclusion. This concludes, I think, the presentation. I think I have maybe one more slide potentially. And yeah, that's it. So I think I saw a question. The fat resorbs as fast as fillers. Does it sag with age? Who should do fat and who should do fillers? Excellent question. So I think if you're looking at one spot alone, so augmenting one little, maybe a malar area or um, one spot, it's not worth going through the whole thing of obtaining fat, a separate harvest site just for, 1 or 2 cc's. I think fat is more powerful because when you go harvest fat, you already have then an abundance of material versus going off the shelf and just getting a syringe, a syringe, a syringe. And so this gives you an opportunity to be able to like add volume above the brows, in the temples, in the mid face, a little bit here to support the lower lip. So fat gives you that benefit. I think fat does not work well in the lips. So lip augmentation, I think, is almost exclusively a filler phenomenon. And I think that's because naturally we don't have fat in our lips, and that's why our lips are pink. You're looking into the muscle. And so there's mucosa and muscle right away. There's no fat layer. And so, adding fat artificially there, one, I think it changes the color of the lips. Two, it never stays. It always will resorb. I do talk to patients. I do say that, if we take a cc of filler off the shelf and put a cc into your cheek, we get a cc of volume augmentation in your cheek. And then filler over time will dissolve. Although we know now, and actually I wrote the study with Dr. Kami Parsa, filler will stay in kind of different parts of the face for 10, 12 years. So it's not as, it doesn't resorb as fast or as much as, these companies want us to think. Fat, if we take a cc of fat, put a cc of fat in your face, maybe 0.7, maybe 0.75, maybe 0.8 lasts. But once it integrates, it's there with you forever. It will continue to age with you. So as you gain weight, lose weight, it's there. It's going to grow and contract with you. But I think that's the beauty of fat. I think it's, the most natural replacement of fat volume that we lose in our face. We're replacing it with fat. There's nothing, filler will never be able to mimic it. It moves naturally with your face when you animate. I think if you do it well, it's great. So that's that. What are your thoughts on alloclay? How does it compare with nanofat? So very different, actually extremely different. I love alloclay. I think it's great for buttock augmentation. It works a lot better than Renuva, the previous product that we used to have. It doesn't go through this dip where the body resorbs it and then it tries to build up within the scaffold itself. But alloclay doesn't really have cells, right? Because that's why we're able to inject someone else's cadaveric fat into another person is they figured out a way to process in a way that it wipes out all the DNA and cells and things like that. It's just basically a matrix that then your fat will grow into. And so what nanofat is, if I guess maybe I didn't explain it so well, it's actually exactly the opposite. It has no structure, it has no matrix. It's purely the regenerative cells that live around the fat. And so, you can think of it as actually if you take fat and you look at structure without cells, that's alloclay. And then if you take fat and take away all the structure and just keep the regenerative and like the cells, that's nanofat. So I hope that answers your question. It's two very different things. I think they're both very useful. I just think that they do very different things. All right, I guess no more questions.
Sorry, doctor. Thank you for your time. I have a question. The question is, there is no any reaction of your body to reject that fat, like sometime in the body when they do in the butt or sometime in the different area of the body?
Are you speaking to alloclay or are you speaking to your own fat?
On fat. I'm talking about on fat,
Your own
different.
fat? No, because it's your own fat. So that's the beauty of it. You cannot reject your own body tissue, and that's the beauty of it. Now, if you don't process it well, and this is where the artistic and the scientific, worlds collide, is that the artistic part is, knowing how much to put and where. The
Okay.
scientific part is understanding how to process the fat in a way that you do not, you minimize the chance of infection, you minimize the chance of resorption, things like that. So we process it in very specific ways to try to maximize retention, minimize how much, fat loss happens. Because if you make a cheek look beautiful, but then 3 days later it all gets resorbed because it was watery fat, then, we really haven't helped anyone. So that's kind of where the intersection is of being a good surgeon scientist, but also an artist, a plastic surgeon artist. And so that you got to add a little bit more to account for a little bit of resorption, but you've processed in a way that you're not going to get much of resorption. And then at the end of the day, you get the contours that you want. Because that's what everyone cares about at the end of the day is getting the results that they came for.
Thank you, doctor. Thank you for your answer. And following the program, this is the last presentation from the morning time. And definitely want to thank everyone for this, for attendance and also the speaker, but also from the beginning we was talking about the social media and internet, the trending, the negative part, but at this point I talking about the positive part because thank God to the internet we have the possibility to be connecting today, especially from different part of the world also. And also we can refer, each professional, either the doctor is not here in New York, but also we can refer him patient. Dr. Olga is here in New York, but Dr. now met Dr. Olga. So this is the miracle of global integral beauty. Thank you very much. And all in the morning we will focus in prevention and regenerative and beauty. Thank you. And we're going to connecting again at 12:50.
Awesome. I'm just gonna put my Instagram handle here in the message
Yes.
chat box,
Yes.
because I forgot to include the slide, or I guess it didn't come through. Is that okay?
Yes, claro, perfect, doctor. And remember that we are recording everything, so we're going to share everything with individual presentation and whole the presentation too. That's why I told everyone enjoy the amazing experience because it's not quantity, it's quality. So we are focused more in quality because everyone is going to see this presentation later. But right now, I just want that everyone enjoy this amazing presentation. Thank you very much.
What if your journey is already worthy of recognition?
I am the beginning. I recognize emerging talent.
The passion that is making a difference. If you are rising, I am looking for you.
I celebrate the harmony between science, wellness, and aesthetics. A holistic vision, professional ethics, the true meaning of integral beauty. I honor trajectory, leadership, and global impact. I don't just recognize success, I celebrate legacy.
I recognize those who transformed the industry. Those who left an unforgettable mark. Those who inspire generations.
Your story matters. Your work transforms lives. Your leadership deserves a stage. Apply today. The next story we reveal could be yours.